Hey guys, it's Natalie here to talk about pyloric stenosis. So, what is pyloric stenosis? Pyloric stenosis is the thickening of the pylorus, or the muscle between the stomach and the intestines, causing projectile vomiting in infants. Normally, food goes into the stomach, and the pylorus acts as a muscular valve to keep the food in place while it's getting digested in the stomach. When the food is ready for the next stage in the digestive process, the pylorus opens, letting the food out of the stomach and into the small intestine. In pyloric stenosis, the pylorus is too thick. It blocks food from leaving the stomach and going into the small intestine. Since the exit is blocked off, the only way out is up. Thus, food goes up the esophagus and out the mouth, causing babies to have forceful vomiting. So, who gets pyloric stenosis? We usually see pyloric stenosis in babies 2 to 8 weeks old. However, it's not unheard of to see pyloric stenosis anywhere between birth and 6 months of age. The symptoms of pyloric stenosis include projectile vomiting, and by this I mean very forceful vomiting, not just the normal spit up that many babies have after feeding. Projectile vomiting would mean the baby is forcefully vomiting up milk up to several feet away, and this usually occurs right after feeding. They may seem hungry all the time, even with frequent feeds, because with pyloric stenosis, not much food is actually getting through, and the babies are forcefully vomiting most of the breast milk or formula up. After enough vomiting, your baby can become dehydrated. Signs to look out for include fewer wet or dirty diapers, crying without making any tears, acting lethargic or sluggish or less active, as well as having sunken eyes or the soft spot on the top of the head could be also sunken. Because of the persistent forceful vomiting, your baby can also begin to lose some weight. So, for diagnosis of pyloric stenosis, the doctor may first ask questions about the history of the present illness. So, how long have the symptoms been going on? What are the symptoms like? How did they progress, etc. The doctor may also ask questions to take a detailed history of your baby's medical history and family history. Your provider will need to do a physical exam of your baby, especially looking at the abdomen. Some babies with pyloric stenosis have a lump about the size and shape of an olive in the upper abdomen. This is the thickened pylorus that we can sometimes actually feel on the abdomen. Your doctor might ask for imaging tests to look at the pylorus. We like to do ultrasounds in babies and kids to avoid unnecessary radiation exposure. The ultrasound would be of the abdomen and could show us the thickened muscle of the pylorus. If necessary, your doctor could also order a barium x-ray. For a barium x-ray, your baby would swallow a special contrast agent, which would be a kind of chalky liquid. As the contrast goes from the stomach to the small intestine, we could see if the exit out of the stomach, where the pylorus is narrowed by taking an x-ray of your baby's abdomen and looking for how the contrast is getting through. Since some babies with pyloric stenosis can get pretty dehydrated from the projectile vomiting, your doctor may also order some lab work. These would be blood tests to check the level of electrolytes like sodium and potassium and see if they need to be fixed or replenished. So, what is the treatment of pyloric stenosis? If your baby has pyloric stenosis, your baby will probably need IV or intravenous fluids to help hydrate them after they've been vomiting so much. We would also want to correct any electrolyte imbalances that might be present. So that was the sodium, potassium, and other electrolytes we mentioned earlier. Ultimately, to fix the problem, your baby would need surgery called a pyloromyotomy if they were to have pyloric stenosis. So, what actually happens during this surgery? First, your baby would be put under general anesthesia to make them fall asleep and not feel the surgery. Then the surgeons would proceed with either a laparoscopic or open surgery. A laparoscopic surgery would be done through a few small cuts with tiny scopes or cameras to help guide the surgery. An open surgery would mean fewer incisions, but the incision would be larger. Either way, the surgeon would hope to make a small, lengthwise cut in the pylorus muscle. They would then use a tool to help spread out the thickened muscle. Afterwards, the pylorus should be wide enough so that food can now pass from the stomach to the small intestines without getting blocked. So, to review, the muscle between the stomach and small intestines, or the pylorus, gets too thick, causing pyloric stenosis and blockage for the food. Since food can't get through from the stomach to the intestines, the baby will projectile vomit or very forcefully vomit. They can get very dehydrated and lose weight because of all this vomiting. And to diagnose it, we usually do an ultrasound. Sometimes we do a barium x-ray. Ultimately, treatment is surgery to fix the problem. That's all I have for now on pyloric stenosis. Please let me know if you have any questions. Thank you so much for watching. I'll see you next time.